Welcome to Sports Doc Talk. I'm Will Sanchez, along with our orthopedic surgeon and sports medicine specialist, Dr. Grant Garcia. Dr. Garcia, we almost didn't have a chance to do this episode because the weather out here is a little bit crazy. Lights are flickering, so hopefully we'll get through this. But this was a good episode to talk about. First and foremost, before we get into it, how are you? Or are you by candlelight? Are you ready with your lamp, your flashlight? What's going on over there?
We're good. I was literally telling you right when we about to record this, and then everything shut down. I was like, "Do you hear the hail outside?" And then lights went out, internet went out, and about 40 minutes we lost it, and thought we're not going to get this episode recorded. So this is exciting. We may get cut short. Who knows how this is going to go? I have candles. I have regular lights, so we're good. Internet's working for now, so we're in a good state.
You know, we're about to have this conversation about the former number one pick in the NBA draft, Mr. Wembanyama. But before we get to it, because we're discussing injuries, we always want to give a shout out to our good folks here at the Recovery Shop. Take it away.
Well, again, our sponsors, Recovery Shop, and hopefully at some point we can have them on. You guys can learn even more about them. But, as a surgeon that does the complex surgeries, having the stuff here again today, I had a bunch of patients in the office that needed surgery, and they were asking, what else can I do? What else can I have? I know you're going to do good surgery. I know you're going to give us the best that you can give us, but what about the post-recovery? And that's really what's key here. So we have nutrition options for patients. We have the options for the NICE machine, which has been fantastic. My patients love it. The Rebliss and other innovative things. And really, if there's a product that a patient wants, I can get it and put it on the Recovery Shop, which is really nice. So it all comes together in one thing. It's essentially, hate to say, is the equivalent of an Amazon for surgical stuff, but really it's all vetted. It's good quality vendors, which is really nice. And as a surgeon, to have this at your fingertips, to have your own personal shop that patients can go to and easily get what they want has been fantastic. So the reviews have been raved. So if any of the surgeons listening are interested, let Mike know. And if you're a patient and you want something like this for your surgeon, you should let him know about it because it's pretty easy and anyone can do it. So thanks, guys.
Mike B at shop-recovery.com. That's a cool name, man. Mike B. It's like a rapper. I don't know. I'm kind of going through my hip hop days. I've been listening to a lot of old school music, so I think that's where I'm triggered. Anyway, I digress like I always do. So let's get into this. The unicorn, Victor Wembanyama, right? 2023 Rookie of the Year. 2024 almost upset the United States. Won the silver, had an opportunity to win the gold. The sky is the limit for this athlete. And less than a week ago, we get news that his season has ended. And not in a way that we usually think, right? When you have someone that's 7'5", 7'6", right? And for someone that is a knee specialist, having someone that big, I'm pretty sure if I would have said, Dr. Garcia, man, Wembanyama is out, you would have, where the first thoughts would have gone? Injury, knee, something like that?
Like Zion. I'm thinking like Zion.
Like
I'm
Zion.
thinking meniscus. I'm thinking cartilage. I'm thinking, just the sheer size. You have Yao Ming, who's obviously a lot older player now, but foot injury, it's always lower extremity for the most part.
Yep. And instead we get a diagnosis of this deep vein, thrombosis, DVT, in his right shoulder. So why don't you explain to the viewers, the listeners, on really what this means? And, I'll let you talk about it because I've got lots of questions.
Awesome. So I thought it was a good episode because I think that for people listening, they're going to say, what the heck is this? This is like really weird. And for my patients, this is actually a very high concern level for them.
Yeah.
And I would say that every day when I'm counseling patients, this is something that comes up and they ask about this. So as an orthopedic surgeon, I deal with DVTs all the time because it's lower extremity or upper extremity. And so this diagnosis is a big deal. So basically what it means is that there are different areas you can clot the blood. So the blood flows around your body like pipes, right? So you got the hot water, the cold water. The cold water is the veins, which is the blood coming back that has no oxygen. And the hot water is the red part. That's your arteries. That's where the blood is fresh with oxygen. Now, most of the time, the arteries don't get clotted very often, except for heart attacks or things like that. But the blood clots usually happen in the veins. So that's why you call them the, deep vein thrombosis.
Yeah.
That's where it's most likely caused. The problem here, which is really weird. So basically, if they get a clot somewhere and that clot backs up fluid and you can get pain, everything else, that sounds bad. But the real problem with this is when the clot goes to either your brain, which is much less likely, but the one that you worry about the most is the lung. And even doing some research on this, there's a few famous people that have actually died from a blood clot to the lung. And I have thankfully never had a patient have this, but I have heard of patients that have had blood clots and it's gone to the lung. So that's what we worry about more. The DVT idea is not as stressful. The idea of the blood clot going somewhere else is a concern. And that's why it's going to be really important discussing this situation, because there's other athletes that have had this, even basketball players in the last few years. And those were, a lot of them were lower extremity. So the leg, which is I see much more commonly. This was in the shoulder. Yeah. So how many shoulder blood clots do I see a year? Maybe one if we're lucky. We actually saw them increase a little bit with COVID, but this is not related to that. But upper extremity blood clots are very uncommon. They're actually more common in athletes than anybody else, but they're just not common. And so one of the thoughts here, we can go into this in a minute, is how did he get this, right?
Yeah.
Was it size? Was it another diagnosis, something called thoracic outlet syndrome? If you read some of the articles, again, we don't have a diagnosis yet.
Yeah.
The number one thing is to get the blood clot out of there. So not with surgery, but to thin it out. But anyhow, so I can go off on this in a second, but this is a big deal because obviously he's out for the season. And the question is why, right? Why is he out for the season? Well, he has to be on blood thinners for 6 months. And if you're on blood thinners, imagine your blood like 6 months.
Wow. Is that just standard? I know you're getting into the explanation, but I just want to cut you off there. Is that standard if you're having a blood clot that you goes, hey, automatic, we're getting you on thinners, you're doing a mandatory minimum of 6 months? What's the protocol when it comes down to something like this? Or does it vary due to age, size, location?
So first off, many of these people get blood clots are people that post surgery. So they're not going back to sports at 3 months. 3 to 6 months ish is when we treat these blood clots. The thing is, he's playing high impact sports. So if he hits his head or he hits his arm and he cuts himself, he could bleed and not stop with this. So that's the biggest problem. And the number one risk is the head, right? Because if you hit your head, usually, you knock it, you get a concussion, right? Like Tua's stuff.
Yeah.
The blood vessels are small, but they can clot pretty quickly. If he's on blood thinners and he hits his head, he could die because it will keep bleeding. It will not stop. And so that's the reason that he's having to stop doing these things, because he could get blood bleeding other places, and that could cause much more serious issues, right? Like let's say he was elbowed in the spleen or something and it popped.
Yeah.
Right. Or he has an injury to his something because he gets, these guys are getting knocked around. Look at them. How often are they
dunking the ball, right? He dunks the ball, doesn't land on his feet, lands on the side. We've seen that, a lot of momentum. Somebody's hanging off the rim, legs go flying up in the air, come crashing down into the back, the lung, the kidney. Those are some of the ramifications, not just getting elbowed or bumped into, right?
Yes, and that's the reason to stop him playing. But also the reason is because if his blood clot's not gone and you hit him or he moves around, you could release the blood clot into his lung. Now, the weird part here is they think that maybe this blood clot came from his leg and got into his shoulder. But that's kind of weird because you got to go through the heart, and you can have a hole in the heart where it goes through, but imagine there's got to be certain stops. But the problem is you don't want it to go to his lung because that's called a pulmonary embolus, and that one is not good.
So as a doctor, how do you check that? What's the process? Because you just told me 3 different things. It's in the shoulder. They think it's in the leg. You may come from the heart. So how do you backtrack to find out where the source is, and then at that point go forward in treating?
So generally, patients with blood clots in their legs or their arms, they're going to have a lot of swelling. So like for instance, even one of my partners who I work with, I got a blood clot after a surgery. It wasn't mine, but it was still a surgery nonetheless. And, even some for an orthopedic surgeon, it took a while for them to figure out, like a couple of days. And basically what happens is a lot of patients, at least post-surgical, and in this case, probably similar, when you get a blood clot, all of a sudden it really hurts and it's really swollen and it's red and it's inflamed. Because remember now the blood, it doesn't always completely clot off, but the blood can't go anywhere. So it's getting blocked. So then it starts to swell up. And sometimes it can even get like a little infections and things like that. But generally it just swells up and it's really red. So it looks like it's an infection, but a lot of times it's a blood clot. And so This is most common in the calf. And so you see these patients and you say, when your surgery recovery, you're 2 or 3 weeks out. If all of a sudden you get worse, there's generally only one thing it can be, and that's a blood clot.
I got you.
And so, to be honest with you, as an orthopedic surgeon, I probably see one of these every month or so. If you don't see these blood clots, either you're not looking for them, and that's really scary, or you don't do enough surgeries, because the odds are very high of seeing them. And every orthopedic surgeon I know has seen one of these. And you can get them before or after too, like your Achilles injury. That is extremely high risk for a blood clot.
Yeah.
Beforehand, or ACL tears. You have patients come in. I had a patient that flew in for surgery recently, and they didn't even check her before, and they didn't realize that she had a blood clot. So I caught it before the surgery. That's okay. As long as you catch it, then you put him on something, which he's probably on, which is a blood thinner.
Yeah.
And then you can do your surgery. You take a break from the blood thinner for a couple of days, and then you go right back on it to prevent the clot from expanding.
Is it normal for someone his age that didn't have surgery, that is in great shape, that runs around, not overweight? He's a slim guy. He was just in the NBA All-Star game where they announced this, a day or two later. He was just there participating. I mean, are there some things that you're going, hey, wait a minute, what, we haven't seen this, or we didn't see it coming, or is it something like it doesn't matter, it just occurs it could come out of anywhere?
So there are certain rare conditions. So baseball players get this, and it's from overhead throwing, and it can be from two scenarios. One, constantly moving the arm and irritating the vessels. So there's something called Virchow's triad. So it's where you have blood that's extra clotty. Probably not in his case. They would have caught it already, but he could be diagnosed with something like that, right? So some people who have this clotty blood, they don't find out till they get their first blood clot. And then they get tested and they find out, or they have a family member that passed away from a blood clot, and then eventually they get tested. So I've seen all these different scenarios. This is probably not that case. Then there's something where he's like, it's not moving, right? Where it's like, he just like sits around, like you go on a plane flight, right? People get blood clots after plane flights sometimes. It's why you can't fly after surgery for the first few weeks. It's why you're not recommended, because you can increase your risk of a blood clot.
Yeah.
You probably see people walking around the plane on long flights. That's what they're trying to stop. And then the third one is injury to the blood vessels. And that's what he could have had, which is, got smacked in the arm, or got nailed in the arm or the leg. And then somehow that injury caused a clot. Now, again, not that common, but Will, we were looking this show up. There's been 4 that we know of that are big. Chris Bosh, right? We all know Chris Bosh.
Yeah.
He had to stop playing because he's getting so many clots.
Yeah. Yeah. He thought he could play through it. He thought he took enough time, but and you're the perfect person to talk about this. The doctors were like, I don't feel comfortable clearing you. You've had a great career. Why don't you go home and chill out? So when it comes down to something like that, and maybe you could talk to the severity, and that's what we're getting at, what is the ultimate, right? As a fan, and just, being concerned about the injury. What's the level of severity? Can it be, something that it's on one scale of severity, or, if you have whatever signs that you want to call it, this can be a little bit more concerning than what you originally may think. How does that get diagnosed now?
Well, I think the thing is figuring out what he has, right? So everyone you've talked about are generally lower extremity. So there's been Brandon Ingram in the New Orleans Pelicans. Yeah. He made it back after a season, but he was a lower extremity blood clot, if I remember correctly. And then Azur Thomas, he's the Pistons. He was actually just diagnosed in March with another blood clot, again in the leg. And he's going to eventually be cleared, hopefully, at the end of the season. So the question is, why did he get this? Because those are all leg ones, right? I think Chris Bosh's was a leg. I think actually Chris Bosh got something to the lung too at some point.
Yeah.
Which is not good.
Yeah, that's the thing you talked about, right? The danger in the lung. Go ahead.
Yeah, and it's usually from the leg, right? Because the leg goes all the way up into the heart. The heart can distribute things out to the arms.
Yeah.
So there is some thought this came directly from the arm itself. If it came from the arm itself, it can be random, which is very rare. Again, I've seen it in COVID shots, or people that get COVID. I've had a couple that got it from that. That's a weird one. And we only saw that. We saw like 2 in 1 month in our practice, and then we hadn't seen them since then. Gotcha. But that's a very rare thing. But generally, it can be something from TOS, so thoracic outlet syndrome. Now, again, We don't have time to go through this entire thing, but basically what it means is like your brachial plexus. Why don't you pull up that image and see if we can show people. So this is a good thing. Go to the next one. Let's see if we can show. So before we go back to TOS, you guys can see. So the blood clot in the leg, it's the swelling, the redness I told you about, and then it can go to the lung. If it goes to the lung, that's when people get a lot of symptoms. They have trouble breathing, and they usually do a CAT scan or a CT scan, and they check to see how the arteries in the lung are doing. Now, people can survive from this. I mean, I have had patients that have gotten PEs, probably 3 or 4 off the top of my head. Now, they all were healthy and they all did fine, but big blood clots can kill, and or if patients are older, that can also be an issue. So it is real, but just because someone says I got a PE doesn't mean that they're going to die. That's something good for people to know. But obviously, we don't ever want that, right? Like, do everything we can to avoid it. Why don't you go to the next slide? One more over there. Go to the end ones that we showed them. I'll show them thoracic outlet. Keep going. Yeah, that's good. Go back to the other one. So this one's really good. So this is a good image. Again, you can see there's that big blue vein. That's a subclavian vein. I don't want to gross out the viewers too much, but that vein can get compressed, and that's probably what he got here, blood clot. And blood clot went all the way down into the arm. Now, thoracic outlet is where you can see that kind of in the middle of the neck. There's a muscle there. People can have an extra rib, and it can push on. It can push on the area as they get like more tension, or they do something like they're throwers. Throwers get it from this constantly cocking back scenario. And the TOS can come in 3 versions, where it can be a version where it pinches the nerves, and people talk about their hams going numb. That's not what he probably had. The other one is where they feel like their arm goes to sleep. So they lose all their blood flow to the arm. That's an artery one. And then the third one is the vein, where it pinches the veins. And that could be what he had. He could have been doing so much of this and blocking and doing all these things.
He does.
He compressed it.
His arms are usually up. He blocks shots. You know, he's
maybe
like, he's a unicorn, right? That this monster giant of a man that just makes it impossible. He was runner-up for Defensive Player of the Year, where his countryman Rudy Gobert won last year. So he's intimidating on the floor, but going back to having those arms up, moving around, especially in that upper area, whether that played a part or not. So knowing the information that we have right now, what is the main concern for you? If you go, hey, we're going to test, we want to identify where this started. Was it the shoulder? Was it the leg? Was it somewhere else? And then go from there. So what's your biggest concern when you're doing this evaluation process and you've already put them on these blood thinners?
So let's assume, to diagnose it, usually, other than the CAT scan, usually it's an ultrasound. So they look at the blood clots and they can see the arteries and the veins. So for me, the number one concern is making sure it's not from anywhere else. Because if it came from the leg, we have a big problem, right? Because that means it's floating around, right? If it came from the shoulder directly, that's a better scenario, in my opinion. Because a TOS thing, a thoracic outlet thing, that's something that's not always that easy to treat. But if he's got it, you could, be much more cautious of that and maybe do repeated ultrasounds, which are really low risk. But what worried me the most is if they found out that he had a blood clotting disorder, right? Because if he makes his blood extra thick, then he has to be on constant blood thinners. That could end his career. I don't think that's the case here. And I think they would have been a little bit more.
How do you check for blood clot disorder? What are the signs, and how do you check for that?
So the signs are you get blood clots, but that's generally there's other things that can be associated genetically, but it's very uncommon.
Okay, so I got a quick follow-up question here. I'm going to interrupt you here. So do you think San Antonio Spurs, they have this information, when they got it, it's really interesting because, like I said, this was announced right after the NBA All-Star break. He was at the All-Star game. But now, what's the documentation as a professional trainer with the information you have? And now you're reaching out to maybe the French ball club, the other clubs that he had been with in the past. How far back now you start tracking down that history to see if there've been any other signs?
Probably not that much, because I feel like if you have a clot like this, either he would have had a major problem or not. I don't think I probably did a pretty good background check for his family. So he may have reached out to his family and they would have been like, hey, tell us if you have a history of blood clot in your family. But generally you don't that doesn't really matter, because if everyone in his family got blood clots, you'd probably know it's genetic. But if they didn't, it doesn't mean he doesn't have it. So I think it's a lot of I think what they do is there's people, doctors called hematologists, and they can run these panels where they take your blood, they look for anything genetic in there, and they have all these different clotting disorders. There's rare ones. I don't think this is the case here. But I will tell you, in my opinion, in my practice, the people that I told you that got those lung clots, or people that have gotten really bad blood clots and have had, almost all of them, we were the ones that found out they had this, because it was the first time they ever knew it. I mean, I can think of a girl 2 years ago that got a blood clot after a big surgery I did, and went to her lung. She did really well afterwards, no issues later on. And we turned out that she found out she has a special clotting disorder. She had no idea. She was 33. She made it all the way to 33 until she figured that out.
Wow. So with this disorder, right, we're talking about minimum 6 months. That puts us probably end of August, right? So shortly after that, maybe we're looking at a month or so, maybe 6 weeks before they start to do training camp, and they kind of ramp up, August, October. So what does that look like now? 6 months. We've done 6 months. What's the process? What's the next steps? So if you're a fan of the Spurs, fan of this young man, you're kind of going, okay, this should be the steps. And if he clears these steps, we can see him participate back in activities for the start of the 2025-2026 season.
Well, obviously, you're going to probably get repeat ultrasounds to make sure that blood clot goes away, right? The blood clot's gone, then that's a good thing, right? And then what you're going to do is he's going to go to this fitness to play panel, and it's made up of 3 different doctors, and they're going to review the case, and they're going to make sure they feel it's safe. And they're not really related at all to the San Antonio Spurs, which is good. It's the same thing as the concussion thing we talked about, right? Because as much as we're team physicians and we want what's best for the player, there's also the team that, they can always be in your ear. And, if it's kind of a gray zone, you don't want the doctor to feel obligated one way or the other, right? So you pull out that scenario. Interesting enough, actually, when we were looking this up, there's actually a study on this, and they found that athletes with upper extremity returned to play faster than those with other type of blood clots. So even though I told you 6 months, it's actually average of 4.3 months for return if you have isolated upper extremity, which is what he has.
The upper and isolated were the 2 key things that you said there.
Upper and isolated. So those other players were lower extremity. They were a longer recovery. So it's just interesting to see that. The one other thing is sometimes they do surgery on this. Hopefully he won't need that, but they can actually go in there and core out the blood clot. They probably won't need to do that in him, especially if they caught this early enough. But again, there are not that many cases of this, so it's not like we have a lot to go on. I'm giving you, over the last 5-10 years, I just told you about 4 players. That's not very many in basketball, right? If you talk about how many people have ACL tears or cartilage injuries and things like that, but it's also not. I mean, I don't know if anybody knows this. We found this out too. Serena Williams had tons of blood clots.
Yeah,
and she was able to play with it. Now, again, tennis, not contact, even though it's a tough sport. It's not contact, and it's just a different animal there. But the problem you have too is, which people don't think about, is, and I didn't even realize this till we did this episode, the travel, right? They're constantly flying. That's like
exactly
blood clot central.
What I was going to bring up, man. I'm so glad you brought that up. That's exactly what I was going to ask you. The travel, do you stretch, cool down a certain way before you get on the plane? Steve Kerr was recently complaining about, you want us on primetime TV. We're finishing up and getting out of the locker room at 1 o'clock in the morning, and we have to get on the flight for 3 a.m. because we have a tip off at noon on the East Coast. So, as someone that is in your position, and will treat athletes, and someone that travels as many times as they do, right? LeBron James recently posted on X saying, look at all the games that we have back-to-back nights, that he was complaining. He was like, this is ridiculous. So what are your thoughts with travel, professional athletes, and from going from 0 to 100 back to 0 and now on a flight?
I mean, it's no joke. I mean, that's one of the reasons these guys have trouble getting back sometimes. I mean, they can return to well, but he's going to be always forever at risk of this happening again, regardless of what people say.
Because
this
it
will be
happened
something.
once?
Yep. As soon as that word blood clot's in your history, if I have that with my patients, like you tell me I've had a blood clot, like I'm automatically putting you on blood thinners for every surgery. Like I don't want this ever to happen again. So like, if he ever needs
Yep.
a surgery, he's getting a different level. Now again, upper extremity is a bit different, and if they find out that he has TOS and it was caused by that rather than anything else in his body, I
Yeah.
think the biggest concern for anybody with him is that if they found nothing, right? We have no idea why he got it. We have no idea where it came from, which I'd be surprised. Hopefully they can find a reason.
Yeah.
That's when we get a little bit more concerned, right? Because then do we just have to assume we have to assume worst case scenario for, this could be a clotty disorder, we can't figure it out, or something else, and we have to be more extra cautious with him. But I can sure as heck tell you that if he has any issues anytime in the next multiple years of playing, they're going to check everything again for this, and it will be on everything. And again, I think a couple years of playing really well without any more blood clot, that's fine. But we know, I mean, look at, I told you, Serena Williams had multiple. Right?
Yeah.
This may not be the last time.
And would you just assume that she was on those anticoagulants, because of those multiple blood clots, and even when she was pregnant, right? I mean, she was pregnant, she gave birth.
Well,
right?
that's really risky.
Yeah.
That's really risky because some of the medicine can have problems. So I'm sure there are different things. Now you can get something called a filter where they put a thing inside of your vein to prevent it from going to the lungs. But in his case, there's no way to prevent it from the shoulder. So like this is it's a little bit more complicated, just the way the blood flows.
Extremely interesting. This is absolutely fascinating, especially to see what the outcome is going to be. I'll be curious to see if they ever, share that type of information and say, no, this was isolated, we're good, he's good, don't worry about it. But as you have already mentioned, now that I'm aware of this blood clot, and next time or anytime that I'm treating that particular patient, that's in the back of your mind, and you're making sure you're doing your due diligence, prepping the patient for whatever he may need in the future. Because as we know with professional athletes, it's only a matter of time. It's not if, it's when that they're going to eventually be and have some kind of surgery, whether no matter how big or small it is.
Well, and I think we could say it's pretty impressive how well he's done so far without any injuries, right? I mean, he's just been
amazing.
kind of is that how many big men, and again, he's got a different build, but how many big guys like him have gotten drafted and then just not done that great? Obviously, he was different. He was extra special, but there are a lot of big guys that have just kind of injury.
Pacific Northwest, Greg Oden, all these guys have come and go throughout the league, and that's what made them special. That's what makes them exciting to watch. That's why you buy your NBA package, to see these incredible athletes. When we watched the Olympics, he was one of the reasons to watch, to see him out there and playing and representing his country and knowing everything that's a part. Someone that could block a shot, could dunk a ball, and then shoot a three. I mean, special, right? And that's why you hope that as a fan, he bounces back. And that's why it was so interesting to have this conversation about this player.
Yeah, and I think for the listeners, I think he'll bounce back. I think he will be. We just have to be, in the show, I'm always more cautious, right? Like, there's always a potential risk here or there. But like I said before from the studies, the upper extremity players get back faster. So there's a chance that he's ready to play sooner, but it won't really matter, right? He's going to start the next year at the season. They're not going to push him any earlier.
Yeah, no, and it's smart by them doing it. And you said exactly. You're cautious, you're optimistic. I'm the ones going, what if this doesn't work? Tell me the worst case scenario. I'm that guy. I'm the one that's just going, oh my, what's got the lights are flickering? We're all gonna die. So, that's part of the yin and yang of our show. That's why we discuss it. Any last thoughts as we get ready to wrap this up? Whether it's about him or just blood clots in general that may be informative for our listeners.
I tell the patients that and listeners, so, obviously this thing's really rare. If you ever have something where you have a lot of swelling and problems in an area and you've got a history of this, beware of it. If you've had surgery, beware of it. You just don't want it to miss it. So if your doctor's saying, hey, listen, it's not a big deal, which hopefully they're not, just go get it checked out. It's pretty easy to get this. You can get an ultrasound anywhere you want. I mean, you can walk into a clinic, you can walk into an urgent care and get the ultrasound done just to say whether or not it's there. I will tell you that it's unfortunate how many of these I've caught when someone else had said, oh, it's not a big deal.
Yeah. And as you mentioned, the lung, the stroke, the heart attack, or anything like that, a lot of it can be affected. So, all right, now that we've scared everybody, we want to thank everyone. Check us out, Sports Doc Talk. We've got some great shows. We've got transcripts. We've got some great guests coming up. So we're really excited about that. And as always, we love the people that, first off, always support us and give us some great shout outs. So if you want to give us a shout out, you have some show ideas, you want us to talk about certain things, check it out. sports.talk.com. We appreciate you. Dr. Garcia, say good night.
Good night, guys. Thanks.